What is the meaning of the endocrine system and what is the anatomy part for pituitary and hypothalamus?
Let's find out together. Please listen carefully.
The endocrine system is a series of ductless glands that secrete messenger molecules called hormone into the circulations. The circulating hormone travel to distant body cells and signal characteristic psychological response in those cells. Through its hormonal signal, the endocrine system controls and integrates the functions of other organ systems in the body. In its general integrative role, the endocrine system resembles the nervous system with which it closely interacts. The hypothalamus is a small region located within the brain that controls many bodily functions, including eating and drinking, sexual functions and behavior, blood pressure and heart rate, body temperature maintenance, the sleep-wake cycles, and emotional states. Because the hypothalamus is a part of the central nervous system, the hypothalamic hormones are produced by nerve cells. In addition, because signals from other neurons can modulate the release of hypothalamic hormone, the hypothalamus serves as the major link between the nervous and endocrine system. The hypothalamic hormones are released into the blood vessels that connect the hypothalamus and the pituitary gland. Because they generally promote or inhibit the release of hormone from the pituitary glands, hypothalamic hormones are commonly called releasing or inhibiting hormone.
This is the type of hypothalamus hormone.
The pituitary, also sometimes called the hypophysis, is a gland about the size of a small marble and it's located in the brain directly below the hypothalamus. The pituitary consists of two parts, which is the anterior pituitary and also posterior pituitary. The anterior pituitary produces several important hormones that either stimulate target glands, like the adrenal gland, gonadal or thyroid glands, to produce target glands hormone or directly affect target organ. The pituitary hormone include adrenocorticotropic hormone (ACTH), gonadotropin, thyroid stimulating hormone (TSH), also called thyrotropin, and growth hormone (GH), and prolactin.
As you can see, there are 7 types of anterior pituitary hormone.
The posterior pituitary does not produce its own hormone. Instead, it stores two hormones called vasopressin and oxytocin that are produced by neurons in the hypothalamus. Both hormones collect at the end of the neurons, which are located in the hypothalamus and extend to the posterior pituitary.
Next, I would like to explain the physiology part of hypothalamus and pituitary gland. This diagram shows how hypothalamus controls the secretion of anterior pituitary hormones. Neural secretory cells synthesize hypothalamic releasing and inhibiting hormones, package the hormone inside vesicle, and transport the vesicle to axon terminus. Nerve impulses trigger exocytosis of the vesicle, and then the hypothalamic hormones diffuse into hypophyseal portal system. Within the secondary pulses, the hypothalamic hormones diffuse out of the bloodstream and interact with anterior pituitary cells. When stimulated by the appropriate hypothalamic releasing hormones, the anterior pituitary cell secretes hormone into the secondary pulses capillary. The anterior pituitary hormones drain into hypophyseal bands and then travel to its target tissues. There are several hormones produced by anterior pituitary gland. First, it is the human growth hormones, HGH. HGH exerts its effects indirectly by insulin-like growth factor IGF-1. HGH helps to increase growth of bones and soft tissue, also make meat feel ATP available for growth. Next, thyroid-stimulating hormones, TSH, stimulate the synthesis and formations of triiodothyronine T3 and tyrosine T4 hormones by thyroid gland. In female, follicle-stimulating hormones, FSH, initiate the development of ovarian follicles and stimulate follicular cells to secrete estrogen, while in male, FSH stimulates sperm production in testes. Luteinizing hormone, LH, trigger ovulation and stimulate secretion of progesterone and estrogen in female, while in males, LH stimulates cells in the testes to secrete testosterone. Prolactin (PRL) initiates and maintains milk production by the mammary glands. Ejection of milk depends on the hormone oxytocin, which is released by the posterior and pituitary gland. The function of prolactin is unknown in males, but hypersecretion of prolactin causes erectile dysfunction. Next, adrenocorticotropic hormones (ACTH) control the production and secretion of cortisol and other glucocorticoids from adrenal cortex. Melanocyte-stimulating hormones (MHS) regulate production of melanin. Melanin is a type of pigment that they're responsible for the color of skin, hair, and eyes. However, excess of melanin causes skin darkening, age spot. Next, I would like to explain the hypothalamic control of posterior pituitary hormone secretion. Neurosecretory cells in the paraventricular and supraoptic nucleus of the hypothalamus synthesize oxytocin and antidiuretic hormone ADH. The vesicle moves along the hypothalamic hypophyseal tract to the axon terminus in the posterior pituitary gland. Nerve impulses trigger exocytosis and release of oxytocin or ADH into the bloodstream. The release of oxytocin or ADH then travels to its target tissue. During after the delivery of a baby, oxytocin affects two target tissue, which are mother uterus and breast. During delivery, stretching of the cervix of the uterus stimulates the release of oxytocin, which in turn enhance contraction of small muscle cells in the wall of uterus. After delivery, oxytocin stimulates milk ejections from the mammary gland. Oxytocin may be also responsible for the feelings of sexual pleasure during sexual activity. Antidiuretic hormone (ADH) is a substance that decreases urine production. ADH causes the kidney to return more water to the blood, thus decreasing urine volume. ADH also decreases the water loss through sweating and causes contraction of arterioles, which increase blood pressure. Dehydration, pain, and stress will increase ADH secretion. That's all from me. Thank you.
Hi. My name is Marina Sofia and I'm from Group 3. In my part, I'm going to present the anatomy of thyroid glands, parathyroid glands, and adrenal glands. Firstly, I'm going to talk about the anatomy of thyroid glands. Thyroid glands are butterfly shaped. It is located between inferior to larynx. Thyroid glands have two lobes, which are right thyroid glands and left thyroid glands. Left and right lobes are connected by isthmus. Next, thyroid follicles. Thyroid follicles are the structural and functional units of thyroid glands. It has two cells, which are follicular cells and parafollicular cell. Follicular cell secrete two hormones, which are thyroxine, or we also can call that tetraiodothyronine, and the another one is triiodothyronins, while parafollicular cell secrete calcitonin. Next, the anatomy of parathyroid glands. Parathyroid glands are small round masses that are located in the posterior of thyroid glands. It measures about 40 milligrams. Parathyroid glands are microscopically. It contains two cells, which are principal cells that secrete parathyroid hormones, and the another one, a civil cell. As you can see, the overview of parathyroid glands. Parathyroid glands have left superior parathyroid glands, right superior parathyroid glands, left inferior parathyroid glands, and right inferior parathyroid glands. And the last one, the anatomy of adrenal glands. Adrenal glands are located on top of kidney. It divided into two central and functional regions. First, the inner part is the adrenal medulla, and the second one is the outer part is the adrenal cortex. Adrenal medulla have adrenal medular chromaffin cells that secrete epinephrine, which is adrenaline hormone, and the other one is norepinephrine. Then, adrenal cortex have zona glomerulosa, zona vesiculata, and zona reticularis. Zona glomerulosa secrete aldosterone. Zona vesiculata secrete cortisol, and lastly, zona reticularis secretes androgens.
Next, I want to explain about the regulation of thyroid hormones. Regulation of thyroid hormone starts at the hypothalamus. The hypothalamus releases TRH into the hypothalamic hypophyseal portal system to the anterior pituitary gland. TRH carried by hypophyseal portal rings stimulate thyrotropin cells in the anterior pituitary to release TSH by thyrotropes. Next, TSH released into blood-stimulated thyroid follicular cells. Thyroxines, or T4, and triiodothyronine, also known as T3, released into blood by follicular cells. Elevated T3 inhibits release of TRH and TSH, which also known as negative feedback. Then, this is the actions of thyroid hormones and action of parathyroid glands. Next, I want to explain about the calcium regulation. First of all, the high level of calcium in blood will stimulate thyroid gland parafollicular cells to release more CT. Then, calcitonin inhibits osteoclast, thus decreasing blood calcium level. Then, low level of calcium in blood stimulates parathyroid gland shift to release more PTH, or PTH is also known as parathyroid hormone. Then, parathyroid hormone or PTH promotes release of calcium from blood intracellular matrix into blood and slow loss of calcium in urine, thus increasing blood calcium level. Then, PTH also stimulates the kidneys to release calcitriol. Calcitriol stimulates increased absorption of calcium from foods, which increases blood calcium level. These steps will go in cyclic from step 1 until step 6. The similarities between glucocorticoids and mineralocorticoids is they are steroid hormones classically thought to be secreted exclusively by the adrenal glands. The differences is mineralocorticoids regulate blood volume and pressure, electrolyte balance, blood pressure regulation, sodium retention or potassium and hydrogen secretion. Aldosterone is the major form to stimulate sodium and water reabsorption from urine to blood and excretion of potassium into urine, while glucocorticoids regulate activation of immune cells, regulation of body functions and cell metabolism, immune system, inflammation suppression. Hormones produced are cortisol, corticosterone, and cortisone. Next, we have androgens. What is androgens? Androgens is a small amount secreted from adrenal cortex in both females and male. And the function of androgens is, at puberty, in both genders, androgens stimulate axillary and pubic hair growth, contribute to adolescent growth spurt. After puberty, in females, androgens contribute to libido or sex drive, and it converted to estrogens by other body tissues. Besides, It controls secretion not fully understood but mainly by ACTH.
This is renin-angiotensin-aldosterone pathway, where angiotensinogen react with renin to form angiotensin 1 and ACE act with angiotensin 1 to form angiotensin 2. Angiotensin 2 release aldosterone. My last part is adrenal medulla. The adrenal medulla is the inner part of an adrenal gland, where the function is to control hormones that initiate the flight or fight response. The main hormones secreted by the adrenal medulla include epinephrine or adrenaline and norepinephrine, also known as noradrenaline, which have similar functions.
The anatomy of pancreas. Pancreas is located behind the stomach in the upper left abdomen. It is surrounded by other organs, including the small intestine, liver, and spleen. It is spongy, about 6 to 10 inches long, and the shape like a flat pear or a fish extended horizontally across the abdomen. So, this is the structure of pancreas. The white part, called the head of the pancreas, is positioned towards the center of the abdomen. The head of the pancreas is located at the juncture where the stomach meets the first part of the small intestine. This is where the stomach empties partially digested food into the intestine, and the pancreas releases digestive enzyme into this content. The central section of the pancreas is called the neck or body. The neck is located between the head of the body of the pancreas. It overlies the superior gastric vessel, which form a groove in its posterior aspect. Next, the body part centrally located crossing the midline of the human body to lie behind the stomach and to the left of the superior gastric vessel. The thin end is called the tail and extends to the left side. The tail part is located at the left end of the pancreas that lies within close proximity to the hilum of the spleen. It is contained within the splenorenal ligament with the splenic vessel. This is the only part of the pancreas that is infraperitoneal. Several major blood vessels surround the pancreas: the superior mesenteric artery, the superior mesenteric vein, the portal vein, supplying blood to the pancreas and other abdominal organs. Almost 95% of the pancreas consists of exocrine tissue that produce pancreatic enzyme for digestion. The remaining tissue consists of endocrine cells called islets of Langerhans. This cluster of cells look like grapes and produce hormones that regulate blood sugar and regulate pancreatic secretion. So, this is the pancreatic islets of Langerhans. There are several types of cells in pancreatic islets, which are alpha cell, beta cell, delta cell, gamma cell, and epsilon cell. Alpha cell that produce glucagon and make up 15 to 20% of total islet cells. Glucagon is a hormone that raises blood glucose level by stimulating the liver to convert its glycogen into glucose. Beta cell that produce insulin and amylin make up 65 to 80% of the total islet cell. Insulin lower blood glucose level by stimulating cells to take out glucose out of the bloodstream. Amylin slow gastric emptying, preventing spike in blood glucose level. Delta cell that produce somatostatin and make up 3 to 10% of the total islet cell. Somatostatin is a hormone that suppresses the release of the other hormone made in the pancreas. Gamma cell that produce pancreatic polypeptide and make up 3 to 5% of the total islet cell. Pancreatic polypeptide regulates both the endocrine and exocrine pancreatic secretion. Next, the epsilon cell that produce ghrelin and make up less than 1% of the total islet cells.
ghrelin is a protein that stimulates hunger.
Action of insulin and glucagon. When blood glucose level is low, stimulate glucagon, and when blood glucose is high, will stimulate insulin. ANS also modulates hormone. Action of others pancreatic hormone. Somatostatin, pancreatic polypeptide, and ghrelin.
This is glucose and insulin regulation. Firstly, when low blood glucose, which is hypoglycemia, it will stimulate alpha cells to secrete, this is alpha cell, to secrete glucagon, and it will stimulate the conversion of glycogen to glucose. And glucose released by hepatocyte raise blood glucose level to normal. And if blood glucose continue to rise, the hyperglycemia inhibit the glucagon, high blood glucose. Hyperglycemia, it will stimulate beta cell here, stimulate the secretion of insulin, and insulin will stimulate the conversion of glucose to glycogen, which is glycogenesis, and increase the uptake of amino acid and increase protein synthesis and speed synthesis of fatty acid and slow glycogenolysis. Lastly, slow gluconeogenesis, and blood glucose level will fall to normal. And if blood glucose continue to fall, hypoglycemia inhibit release of insulin. So the process, it will continue in cycle. When the low blood glucose is low, it will secrete glucagon and become normal, and after it increase, it will become high blood glucose and secrete insulin, and the blood glucose will fall to normal, and if too low, the cycle will continue.
That's all. And I will continue with the gonads, the hormone that are secreted by the testes and the ovaries. When it's come to the endocrine system, we will have the CEO, the general managers, and the employees. Who will listen to the managers? Only the employees. So the CEO will be the hypothalamus, and the managers will be anterior pituitary, and the employees will be the gonads. The hypothalamus will secrete GnRH hormone, which goes to the anterior pituitary and tell the pituitary to release gonadotropin, which is FSH and LH. Then they will go to the gonads, which in male, the gonad will be the testes. It will secrete testosterone and inhibin, while in female, the gonads will be the ovaries. It will secrete estrogen and progesterone, relaxin, and inhibin. The function of testosterone is to develop and maintain male secondary sex characteristics, stimulate descent of testes. This is for the newborn baby, which the testicle will move down to the scrotum naturally during 3 to 6 months of life. Then it will regulate spermatogenesis, while for inhibin, it inhibits secretion of FSH. The function of estrogen and progesterone is to develop and maintain female secondary sex characteristics, regulate oogenesis, maintain pregnancy, and lactation. Lactation is the production of milk. While for relaxing, the function is to increase flexibility of pubic symphysis, where it helps pelvis to absorb weight from your upper body before it travels to your lower body. Then it dilates uterine cervix. This is for the first stage of labor, where cervix open and thins out to allow baby to move to the birth canal. While for inhibin, it inhibits secretion of FSH. We can abstract 4 hormones that are released by gastrointestinal tract, which is GASTR is for gastrin, IN is for glucose-dependent insulinotropic peptide GIP, and STIN is for secretin, while CT is for cholecystokinin.
We can remember the hormones that are secreted by placenta by mnemonic HHEP. H stands for HCG, the second H stands for HCS, E stands for estrogen, and P stands for progesterone. HCG functions to stimulate corpus luteum in the ovary to continue the production of estrogen and progesterone to maintain pregnancy. HCS is also known as human placental lactogen (HPL), where lactogens means lactation. Lactation means milk. It is functioned to stimulate the development of the mammary gland for lactation. While for estrogen and progesterone, the function seems like ovaries. Seems like the estrogen and progesterone in the ovaries. It maintains pregnancy and helps prepare mammary glands to secrete milk. There are three hormones that are secreted by the kidneys, which is renin. No BP means no PP. No blood pressure means you cannot urinate. It is functioned to raise blood pressure by bringing about vasoconstriction and the secretion of the aldosterone. Next is erythropoietin. Erythro means red. It increases rate of blood cell formation. Calcitriol is related to the calcium. It is functioned to aid in the absorption of dietary calcium and phosphorus. The hormone that are secreted by the heart is atrionatriuretic peptide (ANP). As we know, atrial is a part of the heart. It is functioned to decrease blood pressure. Without the blood pressure, heart cannot function properly. Next is adipose tissue. The hormone that are secreted by adipose tissue is leptin. We can remember by the sentence leptin make you thin. It is functioned to suppress appetite and may increase the activity of FSH and LH.